You've written a book called Internet of Healthy Things, and it has become a best-selling book. Why?
Well, we hit the market at a good time, to be honest with you. The idea of the Internet of Things was just coming into people's consciousness, and we just said, you know, this is going to have an enormous impact on how we deliver care. And so being able to write that out at a time when people were hungry, I think was one. And the other is we deliberately wrote the book in a way that's very accessible, so that you don't have to be a medical professional or a technologist to understand it. And I think those two things really allowed us to get widespread readership, which was great.
So people are worried about their healthcare in the US?
Oh, sure. The US is an interesting market for all of this stuff. There's an enormous amount of innovation in digital health, but it's quite fragmented. And yes, people are worried about their health, but they're also, I think, probably more worried about their individual freedoms. So when you start giving them things, tools, strategies for accountability, they get a little bit nervous.
So what were the messages of your book?
So the Internet of Healthy Thing was really about how all of this data is now coming in from wearables, from your mobile device, from GPS tracking, and really if you look at other industries, retail in particular, they've already shown us what that future will look like. You show up at a place like J. Crew and they know what you've bought and they point you to a rack where you can get an accessory, and all that's done through Internet of Things technology. So how will that apply to health? And with all the data coming in, if we can normalize it and if we can get it to a point where it makes sense, then the next phase is we can apply deep learning, machine learning, right? There's a whole aspect of that. And then finally, create a unique profile of you. And with that unique profile, be able to message you in an inspirational way to improve your own health. And so we've seen examples of that, and that's very exciting. When I started doing this work, wearables wasn't a thing, IoT wasn't a thing. So to see it mature in this way is very exciting.
So can you give some concrete examples of the changing of people's opinion and attitude?
I think, for attitudes, we have people now, enough people have now measured their activity that Fitbit is a public company. And I never thought they'd be a public company when they launched. And I was wrong. And so they have wonderful statistics about the population level impact of their device. That's just one example. And I think on average people walk 1,800 steps more a day when they get one. And yes, some of them wind up in the drawer, we know that, but 50% of people actually stick with it. And so that's an example, a simple example, but if 50% of people are walking 1,800 steps a day more than they were before, that's powerful.
Now you've been attending this e-health conference here in Tallinn, and you said that there's some other kind of dynamic in Europe than in the US. Can you talk about that?
Well, the conference has been a lot about data liquidity and standards, and again, that's very important. There isn't much appetite for that in the U.S. at this point, and so we're having to figure out ways to move our vision forward without waiting for that. So I'm delighted to see it happening in Europe, and I'm really going to continue to watch carefully, because if those things can be solved, we'll really get a sense of whether the market will change for digital health. Whereas, as I say, we'll have if you think like a scientist, our control group in the U.S., because there's just not much appetite right now for interoperability and or standardization.
But can Europe learn something from the U.S. experience?
Well, I think so. I think there are ways in which we've done some things we're quite proud of. We've been able to move forward with a widespread adoption of virtual visits with physicians. That's happening. And a number of other, as I mentioned, the sort of attention that wearables and mobile apps are getting to improve health, I think is something to watch. Groundswell, the number of companies that are being created that are selling services into health plans. United Health Group, which is the largest insurer in the U.S., has a program now where they, through their employer sponsors, are giving individuals a tracker for free and tracking their activity data, and then if they meet certain milestones, will get money back in their health savings account. So it's an interesting, from a number of perspectives. One is paying people for their data, and the other is paying people to be more healthy. So there's the privacy angle to that, there's the incentives angle, how long will that incentive work? So I think we'll all learn from that experiment as just an example.
This improves people's health.
Well, sure. Being more active is obviously a big predictor of improved health, yes.
And what about when it comes to chronic diseases and more kind of serious health issues?
So chronic diseases, we've done very well with home monitoring, particularly for congestive heart failure. I saw a movie this morning on COPD here, which is another really good indication for home monitoring. That's moving in the home care industry in the U.S., and some forward-thinking hospital systems are using that kind of a tool as well. So slow but sure progress there as well.
You talk about this new mobile age. What is that?
Well, that's the title of our next book that's coming out in a week, and that's about health technology and aging, and the idea that, you know, we've just added in the last century 25 years to our lifespan through things like public health initiatives and medical breakthroughs. And my grandfather was 49 when he was 62 when he died in 1949. My father died in 2008. He was 88. And, you know, we're all living longer, and that's a beautiful thing. But what we haven't done as a society is really look at how we're going to capture that extra 25 years for productivity, happiness, health, adding value back. And we thought it was important to start to address that in this book, because if we, societally again, if we don't do anything, we're going to actually run out of people to take care of those that are getting older. By 2050, 16% of our population around the world will be over 65, double the amount under 5. So you can just see the trends demographically, and if all we can do for caregiving is a one-to-one relationship, we're just going to run out of people. So now is the time for us to figure out how to integrate technologies in ways that are extensions of our human relationships rather than getting in the way of them. And that's novel territory, and it's a lot of fun to see. There are a lot of startups, a lot of programs in the area trying to get that right.
So we are kind of on the verge, or already living this kind of revolution where you get these technological innovations, people's individuality, and then hospitals and different providers together.
Yes, on the provider side, what our big challenge is, again, we have to decide when can we do one-to-many care. Today, all you get is one-to-one. You come visit me in an office, you get health care. There's so many other industries that have moved beyond that, where they can deliver a service with a human being, but wrap it in a mobile wrapper that allows it to be much more efficient. And that's our challenge for care delivery. And our societal challenge is just, again, creating those tools that allow you to have a sense of purpose. The three things that predict longevity, sense of purpose, social connections, and physical activity, once again, are really important. And we can use technology to help folks harness their wisdom, their mentoring, their ability to give back using those tools.
Where are we standing in about 5 years' time? What is your vision for the near future?
Well, you see, in 5 years, and if it's in healthcare delivery, it's like a quarter in any other industry. It moves very slowly. But what we're seeing is tools like virtual reality, artificial intelligence, are becoming much more integrated into care delivery in interesting ways. And those things are going to happen over the next 5 years. We'll be more and more using things like chatbots and other tools. As I said, to extend relationships to one-to-many. Again, we have to do it thoughtfully. We have to do it the right way so that no patient feels like they're being robbed of their relationship with their physician. But I'm sure we can do that, and again, we have to do it.
What do you think is the biggest challenge? People's fears or conservative attitudes towards new technology?
You know, it's a great question. On the doctor side, it's fear of work. We are deathly afraid as a profession that technology is going to take over our jobs. I think most people are at some level. On the patient side, it's what I said earlier, which is fear of losing your relationship. And that's because those of us who give the market solutions in digital health, really haven't done a very good job of giving people something that we've under-imagined how we can use technology. And if you think of companies like Uber and Lyft, we haven't done anything like that in healthcare, where you can have this enormous experience that's actually fun, but you have an experience that's delivered by a human being in a very efficient way. That's our challenge in healthcare delivery, and that's why I think a lot of people, when they think about integrating healthcare, technology into healthcare, they think about two kinds of experiences. One is that phone tree experience where you can't get a person. It's really frustrating. The other is, at least in the US now, because of our integration of electronic records, when you go to see your doctor, usually your doctor's typing and not looking at you. And that's really off-putting. So we haven't given our patients much hope that we can integrate technology well. So we have to do that better. And as physicians, when it turns out that technology will not take over our job, we just have to rethink what it's like to be a caring individual, to use emotional intelligence, to use judgment, to pay attention to quality. Those are all tools that machines can't do. But the things that we spend all of our time and energy on, like gathering data, formulating a hypothesis, technology can do that better now. So we need to just change our thinking a little bit.
So it is a matter of confidence and belief building and communicating these changes.
So, you know, as doctors, we've sort of lost our way a little bit. We became really passionate about how we could be technical experts rather than caring individuals, and we've just got to get that back.
Thank you.
It's a pleasure.